Hello, I'm Dr. Anita Knight Coonley, and I'm joining you here today with my stellar co-instructor, Mr. Pierre Durant, and we're here to talk with you about the theories of counseling. I'm going to go ahead and share my screen with you so we can share a few slides with you here. It's interesting. Mr. Rogers, Carl Rogers, and many influential therapists believe that it was important to discover the truth about ourselves. It's hard work, but it's certainly worth the effort. And so with CBT, one of the ideas at the root of CBT is that we have these core beliefs, and we're unpacking core beliefs through some of the interventions that are used in CBT. There's an old proverb that says laughter is the best medicine. So we wanted to share something with you that's one of those recurring CBT jokes. Pierre, have you heard about this idea of the tyranny of the shoulds?
I have.
And will you talk a little bit about this idea?
So the tyranny of the shoulds. Um, Oftentimes we speak to ourselves and we talk a lot about what I should do or what I should not do, and it's important that we don't get too preoccupied and wrapped up in the shoulds of our lives. And I think Dr. K, you put it well in the past. What is it? What is your phrase that you that you use?
I can't take credit for it. I heard it from Dr. Parker, and I'm sure there's an original source. But one of the things that I learned when I was learning theories is our professor told us that there was an expression that uh, you don't want to should all over yourself, right? Because if you're saying, I should be studying, I should be working on this, I should be doing that, there's all this pressure from all these shoulds. Um, and so it feels different if you think about revising that to say, I want to study. So
Mm,
how is I want to study different from I should study?
yeah,
Um,
I think that's especially relevant nowadays with COVID and with the increased pressures of all of our different aspects of life. I was just talking to a professor about just just praying that we, take the pressure off of ourselves, but also that we're prayerful and that it takes a lot of endurance and stamina nowadays to continue to be productive in our professional lives, continue to be productive in our academic lives, to continue to be productive in our familiar relationships when we've been worn down by isolation, by mimicking some of the symptoms of depression, even if we don't necessarily deal with that on a regular basis. We are forced to, be indoors to some degree, to be isolated from folks, and so sometimes you can get caught up in the shoulds of life, like I should be more motivated, I should be uh, more, empowered and productive in the different areas of life. However, it's important that we understand that with new situations that bring new issues and new struggles, that we can have grace with ourselves to know, hey, this is something we've never endured before, and to not get caught up in those shoulds, but to understand, hey, I want to do this, and I'll do it to the best that I can. You know.
yes, it's a very good word, to give ourselves grace for those shoulds, because when we say I should do this, I should do that, there's a sense of maybe guilt or pressure or even lack of empowerment that something from the outside of us is kind of putting something on us that we should do. Where if a student's pursuing a degree, they want to earn that degree. They want to have a master's in counseling, or they want to have that PhD. So in a sense, there's a part of them at least, right, that wants to study, that wants to learn, be prepared to do that job of counseling. And it can feel more empowering to say, I want to do this than
Mm.
I should do that. So that's a great point there. All right. Well, we just wanted to give you guys a brief overview of some of the key players in CBT and share a few thoughts with you to keep in mind as you're going through the reading. Some key players to look for that have informed the development of CBT over time are Albert Ellis. He developed REBT. He was known for having a very eccentric way of presenting himself, often speaking very colorfully, peppering four-letter words throughout some of his language as he interacted with clients. And then Aaron Beck and his daughter Judith Beck were also key players in cognitive therapy, a precursor to CBT. And then Christine Podesky's strengths-based CBT has been influential in the field, and Donald Meichenbaum. And our library database has a counseling and video with Donald Meichenbaum in session. And I really like watching him implement CBT. So some great examples there. And he really implements it well. So these are some of the key players to look for as you're reading and looking at the way CBT has developed across time. Now, more currently, Jim McCullough has developed CBAS, which is cognitive behavioral analysis of system psychotherapy and evidence-based treatment for chronic depression. And as you can sense in the name, cognitive behavioral, you can guess where that theory may have its roots. Now, it's a very distinct and distinguished form of treatment that's different from any other form of CBT that I've seen. But there are concepts like a situation analysis, kind of like the structured ABC approach. With situation analysis, you have a situation, a snapshot in time, you have an actual outcome that you ask your client to identify, and then you have their interpretation, and you're helping them to keep all of these things distinguished and separate. So a lot of times there's a measurement between interpretations and actual events, so that with CBT and with CBAS, there is this process of disentangling thoughts and feelings and behaviors and understanding that they're connected, but they're also distinct. And what excites me about CBAS is that it is one of the few forms of treatment that's evidence-based for chronic depression. And when it comes to talk therapy, a lot of times there's not a great response rate for chronic depression. A lot of people are referred for medication management, see a psychiatrist, but CBAS has some good data to support it. Pierre wants to talk with you a little bit more about some of the defining characteristics of behavioral therapy.
Yeah, so as you can see, one of the assumptions of behavioral therapy is that abnormal behavior is developed um, similarly as normal behavior. So there's obviously a root or an antecedent that occurs to where clients are kind of originating their thoughts, feelings, and beliefs. So assessments of um, of these issues occur constantly, and is concentrated on the origin of that behavior. So as I kind of just touched on there, so people consist of their thoughts, feelings, and beliefs, as Dr. K kind of mentioned a little earlier. Um, and treatment is based on theoretical and experimental findings. So it's going to be very specific steps. It's very structured. Treatment and therapy is with CBT, and it can be replicated. So you're seeing the experimental method in terms of research. And when conducting research on CBT, we're examining the effects of the particular techniques and methods on clients presenting problems. Um, so outcomes are evaluated based on said treatment's ability to induce change and progress within the client, its ability to be applied across general life situations and experiences, and then how that extends over time. So can the client maintain this progress and change over a long period of time? Not hoping that they are just, adjusting and restructuring their thoughts and beliefs within session, but can they take that outside of the counseling and therapeutic space and apply, these structures, these techniques, and kind of mechanisms within their life and become functional. So those are just a few defining characteristics of behavioral therapy.
Excellent. So as we think about this overview, the key players in CBT that fall under the umbrella of CBT, Um, Also behavioral therapy and these defining characteristics of behavioral therapy, we wanted to leave you with a concept to contemplate. Albert Ellis, the founder of REBT, believed that blame can be at the root of many of the emotional struggles that we face. So, how do you think blame factors into maybe the stressors and struggles you've experienced in your own life? Until next time.
Contemplate these concepts.
Contemplate these concepts.